Good evening and welcome to Wango Spaces. Today we want to tackle a topic that is very important to everyone, which is defining healthcare delivery in East Africa. Wango Capital search company that will leverage digital media to share information on East Africa's financial markets. We seek investors about what organizations and firms do and help them digest company financials. And so today we are here with two speakers from Informa Markets, and we're going to just delve into the healthcare delivery in East Africa. Just to go straight into it, welcome Cynthia and Tom, if you can hear me.
Hi, good afternoon, everybody.
Good afternoon to you. Thank you for being here with us. Cynthia, can you hear me?
Yeah, I think Cynthia, we're just waiting for Cynthia to join, but we can start anyway.
All right. We all know that over the past years, we've seen Kenya has become one of the East Africa's major economic hubs, making steady progress in addressing its population health needs, while the country has made changes to its governance, of course, and then the structure to give greater authority to citizens. Inequality persists between the wealthy and the poor, urban and rural, and many still have minimal access to high-quality healthcare or social services. As we talk about redefining healthcare delivery in East African markets, we are joined today with Tom Coleman and Cynthia Makarute, if I got the name so well, from Info Markets. And they're going to tell us what is the reflection that they have on the Kenyan and East African healthcare space as a whole. So as we wait for Cynthia, maybe Tom, you can just go ahead and tell us a little bit about yourself and your journey. And what is a reflection of the space of healthcare delivery in Kenya and East Africa as a whole?
No problems. My name is Tom Coleman. I am the exhibition director here at Informa Markets. So I look after the African portfolio. We have events in Kenya, in Nigeria, and in South Africa. Today we'll be talking about Medic East Africa. And I'll hand over to Cynthia now.
Thanks, Tom. Good afternoon to your listeners. Good afternoon to you. My name is Cynthia Makarite, and I'm the conference director for Informa Markets. I work on the Africa and Middle East portfolio. Obviously, today we're here to talk about the Medic East Africa event, which takes place next week. So let's get into it.
Thank you for those introductions. So maybe you can just touch a little bit of what is a reflection of the healthcare, the Kenyan healthcare system?
Sure. I think Africa in general faces lots of healthcare issues. The East Africa region in general faces some unique challenges in terms of dealing with healthcare. However, all is not lost. There are many very positive trends at the moment that the region is making towards realizing good and quality healthcare, such as public-private partnerships, in addition to equipping the public and private hospitals and upskilling them and the workforce to be able to take care of emerging diseases and current outbreaks.
Mm-hmm. Okay. Cynthia, what do you think about the healthcare delivery system in East African space?
Thanks for that question. You know what? Having worked on the Africa portfolio myself, I'm African as well. Mm-hmm. So I work on African Health, Medic East and Medic West. Tom said the challenges are not different across Africa, but I think in Kenya in particular, Kenya has the advantage of people that are highly receptive to technology, which gives them a good edge in terms of dealing with the current crisis in healthcare across the region. So I think Kenya is in a good place to facilitate some big changes across the healthcare system because of the access to technology and because of the big kind of playground for healthcare entrepreneurs that the country provides.
That's interesting. That is a very interesting observation. And it's true, Kenyans, we love technology. We embrace it so fast and so quickly. And speaking of technology, they say never waste a crisis. We saw COVID-19 pandemic in 2020 that came, and it disrupted quite a number of things. So government closing borders, supply chains were disrupted. We saw PPE equipments were ramped up in different countries. There was introduction of even telemedicine systems maybe. So speaking of embracing technology as a country, not just in Kenya only, but East Africa seems to be a high potential healthcare innovation market. And the digital healthcare space in East Africa has numerous niche and opportunities that require maybe connecting the dots so that between the health between healthcare systems and technology innovation. What are some of these key emerging trends that we've seen in the healthcare industry, just across East Africa, not just in Kenya alone? Cynthia, you can take that.
So if we're going to talk about how healthcare is affecting some emerging trends, we can talk about remote healthcare service. Obviously, Africa, not every place is urbanized. So there are rural places. And for the first time, I think the pandemic is what forced people to really look into this a little bit more. For the first time, there's a focus on providing quality healthcare for people in rural areas that are not normally accessible. And obviously, technology is like the linchpin that's allowing us to do this. Another focus for technology is personalized care. Okay, so the world in general is stopping this focus of treating people with different healthcare ailments in the same way. Now you look at where the people are from, what kind of circumstances they're in, what they can afford, and their genetics, and it's personalized, right? So that's where technology is taking us to this place. I think Africa is not exactly kicking and screaming going, but it's going in this direction anyway because of the use of technology. And then we can also look at the use of modern technology in diagnostics as well. So, of course, again, the pandemic, it was the issue. We were taking our time as Africans to get to that place, but the pandemic, we needed to take care of a problem that required us to equip ourselves with a diagnostic issue, and we had to do it. So now it actually produced a lot of young entrepreneurs in the technology space for healthcare, which makes things very interesting for Africa, I think, in general.
That's interesting. Tom, you have anything to add on that?
No, I think really going into the next notes about the event, I think Cynthia's covered everything there.
All right. Yeah, we see Informa has an event coming up in September. That is next Wednesday, from the 13th to 15th of September. Maybe you can tell us what is the aim of this summit and who is attending, or who are you expecting to be attending the summit, and what are some of the key topics to be tackled? Because we've seen previous summits before, even Informa has had previous summits before on healthcare. What is some of the key topics you're going to tackle this time around, and how will the summit also help the professionals who are in the healthcare space?
Sure, no problem. I can take that. So this exhibition and conference is going to be the largest healthcare event in East Africa, not just in Kenya, but in East Africa. The summit aims to bring together international and regional healthcare communities. We want to improve healthcare delivery for people and transform the future of healthcare in East Africa. That is the goal of this event. We'll be looking to attract over, I think our last numbers that we looked at this week, we're very close to 5,000 unique visitors already, and we still have a week to go. This is going to include professional visits from around the world, making it the biggest, like I said, the biggest in the region. The event will showcase 150 exhibitors altogether. That is local and international. Some of the big brands that we're going to have on board, some of the big diagnostic companies like Cynthia spoke about there, Abbott, Snibe, Siemens Healthineers, Crown Healthcare. These are all companies that have confirmed with very large stands, bringing the latest technologies as well. There's going to be a lot of product launches for the region, which we're very excited to see. But some of the countries that are represented as well, it really is a global approach. We're going to have companies coming from France, Greece, Italy, Romania, Cyprus, Switzerland, Turkey, Kenya, China, India, UAE, and United States of America. So there's a lot of people traveling from all around the world for this event. So we're very excited about it.
Okay. I've seen you mention quite a number of partnerships in private sector, different governments. Cynthia, you can add on it.
Right. In addition to the exhibition, we're also going to have a 3-day congress too, in fact. So one of them is the Healthcare Summit 2.0 conference, which is basically us bringing together key stakeholders in healthcare in the region to discuss topical issues that will create conversation. That's what we aim to do, right? That's the point of a conference. You're trying to create a platform for people to address issues at the highest level. And that's what we're trying to do with the assistance of government speakers, private sector speakers, etc. In addition to that conference, we're also going to have another 3-day conference on laboratory management and all things lab essentially. So this will be for lab professionals, policymakers, researchers, technology experts, and they can also come together for an educational experience. One thing to note, both of these 3-day conferences will be free to attend. If you are in that line of work, this would be an opportunity for you to come and learn about the latest information in terms of healthcare from the lab side or the clinical or the management side. Aside from all of that, of course, we can't do this without getting together the best speakers regionally and internationally. So we'll have different experts who are leading experts on healthcare excellence, public health, healthcare equity, etc. And they will come to talk about the public and private healthcare challenges in the region.
So can someone like me who is not in the healthcare profession, but the finance maybe profession, attend to this kind of a seminar? Because I'm a consumer of healthcare products. Sometimes the systems affect a person who, like me, who is not a profession in the healthcare system. So what can I look for or forward to if I have to attend this summit?
What I can tell you is the healthcare summit in particular, I'll talk about that one because that would affect somebody like you. The healthcare summit, this is talking about the future of healthcare in your region, right? You want to know what your government is involved in to create the best healthcare system to address your needs. That's what you want to know.
Yeah.
So if that concerns you on any level, then yes, it would be an ideal place for you. But I think more so healthcare professionals within the healthcare space, this is definitely the space for them because they need to know how to be agile in their businesses as healthcare providers. And they need to know what the plans are from the highest levels so that they can address what needs addressing within the sector.
Okay, I see. Tom, what are some of the key checkouts that we should look forward to in the summit?
Yeah, I think what I wanted to add, Namsia, is that the one thing is that I would like to point out is that for the very first year, we're supported by the Ministry of Health, Kenya. We're also supported by the Kenyan Health Federation, which we've never had before. The last event that we did was in 2019. So really, I think the support of those two governing bodies has really helped us propel a lot of the audience which will be coming this year. But I think to answer your question, some of the companies that are exhibiting, some of the product launches that we've already seen here in the Middle East at the start of the year, I think that's the most exciting thing that some people in the region won't have seen in some of the public and private hospitals. And I think it gives the hospitals a great opportunity to potentially work with some of these big consumer brands that are coming to the show.
Okay. I think now we can ask Cynthia to tell us what is the cutting edge insight and the best practice in the healthcare excellence and the public health.
Yeah, so what I can say to that is, and I think we get asked these kind of questions often when we host these events.
When they hold the summit.
Yes, when we host the summit. But what I want to remind you and your audience would be that our company is an events company. And what we do is we do research. We will talk to everybody in the field. We will talk to government. We will talk to private sector. We will talk to the NGO scenario. Everybody involved in healthcare. And they will tell us these are the issues, A, B, C, D, E. And what we then do is provide the platform for the conversations that all of these stakeholders want to have. That's what we do. We bring them together. So when we do that, it's up to them to utilize the opportunity to do something for their different countries and for the region. It's up to them to make decisions at these events that will change and affect the healthcare systems in their country. So we could say what the cutting edge insights are based on Congress or discussion, but what we really can see across the board is really all of these people need to start collaborating. That is the biggest insight I can give you. All of these stakeholders need to start collaborating within their own space to understand each other and each other's challenges and each other's needs. That way, all of the different stakeholders can make impactful change within the healthcare sector. So we can talk about collaboration. I would say that is the biggest insight into any healthcare system, particularly right now. The COVID pandemic was a big evidence of that. The government couldn't do anything by itself. Private sector couldn't do anything by itself. So why have these two parties not been talking? Why have they not been communicating? That's what our events provide. They provide that space for them to have the conversation. And when they have the conversation, it's up to them to make the decision and to create best practice for healthcare excellence in their own country. So my biggest insight would be cross collaboration among the different stakeholders is the most vital thing right now for any healthcare system, especially in Africa.
I hope we have successful collaborations between government and private partners during the summit so that we not only have summits to talk about all these problems we have and innovations and how we can do with them, but we hope that we have successful collaborations between governments and healthcare providers. Since most of it will be discussed during the summit, I'd like you to maybe just invite people on and tell us the dates, what are the times, what are some of the topics, main topics to look out for. You can repeat that. Just invite the audience and tell them what to expect during the summit. Tom?
Sure, no problem. Medic East Africa is going to be taking part at KICC Exhibition Centre. It's actually going to be next week, so it's going to be from the 13th Wednesday to the 15th Friday. The show timings are going to be from 10 a.m. to 5 p.m. And I think, as Cynthia mentioned earlier, it's free to attend. So we really want to see as many collaborative people as possible, invested dealers, distributors, C-suite, government, private, public, clinicians. We'd like to make sure this show brings everyone together, and we hope to see everyone at the show next week.
Okay. We look forward to having a nice event as well. Cynthia, anything you'd like to add and invite our audience?
Sure. Just to reiterate that, like I said, the Congress, which is the conference part of the show, is definitely going to be over the 3 days as well. The Healthcare East Africa 2.0 Summit will be for your C-suite, your management, your hospital. Those kind of professionals will be there to talk about healthcare excellence, public health, and healthcare equity. And then for your lab professionals, so that's your lab technicians, your lab managers, etc., we're also going to have the lab education aspect. And one more thing to note, if you are looking to increase your CPD, this is also the event to attend for that. So your professional development plans, we will be providing them for both conferences. Each day you will gain 5 CPD points. Thank you.
Okay, thank you. Of course, we had someone asking what are some of the topics that will be covered in the 3 days, and I think Cynthia has mentioned some of the topics, even Tom, that will be covered during the summit. And laboratory experts, healthcare professionals, you're all welcome to the summit, and CPD points will also be earned during the summit. I think that question has been answered. Before we just close, maybe I can ask any advice for those who are starting their career in the healthcare space. What kind of advice can you give them? Tom, you can go first.
Yeah, sure. No, I think, as I mentioned before, I think there's going to be so many different job titles at the event next week that's going to give a lot of opportunity. We're going to have some really senior government people down at the show, from the Ministry of Health and Kenyan Health Federation. They're also there to talk about potential careers for people that are looking to get into the healthcare industry. But we also have many successful businesses and sponsors that are going to be on the stands that are also working with many distributors and companies within Kenya. So I think there's going to be a lot of opportunity. And also Informa Markets, our team is going to be there. We're going to have nearly 20 people on site next week. So we'd also like to answer any questions on site and help any people around the show.
Okay, Cynthia, any advice you can give an upcoming or a student or someone who wants to get into the healthcare space?
Sure. What I can say is the healthcare industry is fast-paced and it's fast-moving. They change every year. And this is one of the ones with so many opportunities for young entrepreneurs, young people who want to be educated in medicine, etc. There's so much happening and there's so many opportunities. And it's an industry that's not going anywhere. As long as we have sick people and pandemics, etc., it's not going anywhere. So it's a good one to join. Thanks.
Let me just add to that as well. We're actually going to have a lot of the private hospitals actually exhibiting at the show next week. So people will be there on hand also to talk about potential careers So I think that's a good opportunity for people to have a look at the floor plan and see those hospitals that are exhibiting.
Thank you so much. Now, I think this is one of the few spaces that you've had that has been quite short, and it was mainly because we wanted to let people know about the summit that is coming up with Informat. And thanks, Tom and Cynthia from Informat, for talking to us just a little bit and a snapshot of what the summit will be about. And we look forward to everyone coming on board and visiting. We've been told it's free, actually. And there's a lot to learn. Just had the topics being covered overview. So I believe there's a lot to learn when you visit the summit, the hospital that will be showcased, the different people in the different healthcare service delivery will be there. So if you're a student, you are still in school, you're learning, you are in the space, your challenges you face, I believe this is a summit that you will not want to miss. And so we welcome everyone to the summit. And thanks, Tom and Cynthia. You can just give us your parting shots and then we close the spaces for today.
No problem. Thank you, everyone, for attending today. I just want to reiterate, we look forward to seeing you all at the show next week from the 13th to the 15th. Also, you can go online at mediceastafrica.com and you can register there for free. So look forward to seeing everyone at the show.
Okay. Thank you, Tom. Cynthia, your parting shot?
Sure. Yes, thank you all for attending, actually, for this session. But we do look forward to seeing you all next week. Lots of people for you to meet, lots of opportunity for collaborations if you're already in the industry. And hopefully you also get to learn something new. Thank you.
All right. Thank you, Tom. Thank you, Cynthia, and everyone who has been on our spaces today. Thank you for being here. Thank you, Mango, for hosting us during the spaces. And we look forward to meeting everyone else in the summit. Thank you.